So angioedema, as was mentioned, there was a drug called as emapatrilat in Overture trial, which actually was a ACE inhibitor along with sacubitril, and it was banned because of dangerous angioedema. And such angioedema, like grade 3 angioedema, is never seen with ARNI. But yes, if the patient has any history of angioedema, that this molecule is not to be given. And this angioedema was not very significant, hardly 0.5% versus 0.2%. Hypotension, as I've mentioned, is the only issue, only in 18% of patients, and that can be also managed very well as compared to 12% in enalapril. Impaired renal function was lesser, 3% versus 4.5 in enalapril. Hyperkalemia 12 versus 14% in enalapril. Cough also was lesser in ARNI as compared to enalapril. And renal safety, the risk of hyperkalemia associated with the use of MRA was lower among those treated with ARNI in those treated as compared to enalapril. So basically, if you start the patient on ARNI, the hyperkalemia, which happens because of MRA at times, if you combine them with ACE inhibitor, goes down. In fact, SGLT2 inhibitors also have shown that the tolerability of MRA is improved and the hyperkalemia also is lesser. And what are the contraindications that I mentioned? Within 36 hours of ACE inhibitor use, don't use it because you can have angioedema or a lot of cough. Any history of angioedema, pregnancy, lactation, severe hepatic impairment like child C. Aliskiren use, aliskiren generally not used now, or any hypersensitivity drugs. Some caution, because mild to moderate eGFR decrease, there is no need to adjust the dose. If eGFR is less than 30, you have to maybe give a 50 milligram BD dosage, at the most 100. Hepatic impairment, like no starting dose adjustment required for child A class, and hardly 100 milligram BD dose in higher class of child. Systolic BP less than 100, volume depletion, renal artery stenosis, these are also, they have to be slightly cautious in starting this molecule. What are the drug interactions? ACE inhibitor is contraindicated. Naturally, aliskiren should not be used with this molecule. Anyway, aliskiren is not used. Potassium sparing diuretics, if they are used, look for hyperkalemia, especially in patient with diabetes or hypoaldosteronism. NSAID should be avoided. Lithium, if the patient has some psychogenic tendencies, there is a risk of lithium toxicity. And naturally, birth control pills containing drospirenone should be avoided with this molecule.